pay some special thanks to a few of my colleagues. The first and foremost goes to Dr. Abu Hassan, who is located in Windsor, Ontario, and he is the co-author of the Canadian Position Statement. He's assistant professor at Western University, and he's a diabetic lead at the St. Airy St. Clair Lynn. And he was actually the first person who introduced me the concept of diabetes in Ramadan when I was doing a return of service in Chatham, Ontario. He was the physician who approached me because in that community, I was the second Muslim family physician. He said, would you like to learn? How would you teach your patients with Ramadan and diabetes? So I got actively involved with him back in 2011 till 2014. So we used to go and do different seminars back in Windsor, Petrolia, Sarnia, Chatham, sort of a southwestern area. And his dietitian, Rahaf, was a big asset. So Allah subhanahu wa ta'ala has provided me with a team at that time, and alhamdulillah, Allah has blessed me with Shaista. Along with them, I would like to pay my thanks for Noreen and Tamina, who has kind of helped me to customize this statement in terms of, how we can best present to family physicians. This is the Ramadan series that we have been actively involved in. It's a 4-part series where the purpose is to revive back the sunnah of taqwa in best of our efforts, and how we can do good choices in Ramadan, both with healthy and diseased population. So this March 4th, it will be Dr. Sharif who would be talking about, is fasting safe for me or not, and he will go over a few things. So we will be doing the recording, so if you have a chance, you can see that. Some acronyms everyone is familiar with. I'm just gonna go through it. So the key message of this statement is to educate the Canadian health professionals how to manage patients with type 1 and type 2 diabetes who intend to fast in Ramadan, as well as these patients who intend to fast should receive a very individualized, customized assessment pre-Ramadan. This is the most emphasis. The statement says that it has to be evaluated pre-Ramadan, and we have to risk categorize these population, and we have to make a very individualized diabetic management plan. The objective of my presentation is to discuss what is the recommendation, and mostly in family medicine perspective, discuss few things about prevalence of diabetes worldwide, Muslim world and Canada, so we can understand its importance, and of course talk about the recommendation and highlight insulin or like oral versus injectable switches and recommendation, and discuss about the Ramadan nutritional plan that has been recommended for the people who will be fasting, and of course the common myths and misconceptions that's there that most of the patients will ask us. So I've kind of added that.